Introduction: the silent warning signs you must not ignore. Picture this. You're strolling through a park, soaking in the crisp air, when an unexpected cramp grips your leg. You brush it off as fatigue or the inevitable toll of aging. But what if that fleeting pain is your body's desperate cry for help? A cry that, if ignored, could spiral into devastating outcomes, like losing a limb or suffering a heart attack. While most of us link blocked arteries to heart problems, few realize the same danger can lurk in our legs and feet. Peripheral artery disease, PAD, is a silent, stealthy condition where plaque clogs your arteries, choking off blood flow to your lower limbs. Left unchecked, PAD can lead to excruciating pain, non-healing wounds, infections, and in severe cases, amputation. Even more alarming, it dramatically raises your risk of heart attacks and strokes. In this article, I'll reveal 7 critical warning signs of blocked arteries in your legs and feet, backed by real-life stories, medical expertise, and actionable advice. If you notice any of these symptoms, don't dismiss them. Your body might be sending you a life-saving message. 1. Unexplained leg pain or cramping, more than just fatigue. A few years ago, I had a patient named James, a retired firefighter. James loved taking long walks, but he started noticing something odd. Every time he walked for a few minutes, a sharp cramp would strike his calf. As soon as he rested, the pain disappeared. Thinking it was just aging or dehydration, he ignored it for months. Until one day, he couldn't even walk a block without excruciating pain. This symptom, known as intermittent claudication, is a hallmark of PAD. When arteries narrow due to plaque buildup, your leg muscles don't receive enough oxygen during activity. The pain often starts in the calves, but depending on where the blockage is, it can affect your thighs, buttocks, or feet. Over time, if PAD worsens, you may even feel pain while at rest. A major red flag that shouldn't be ignored. In the US, a study by the American Heart Association found that around 8.5 million adults have PAD, but most fail to recognize early symptoms. One such case was Linda, a retired teacher from Florida. Linda experienced cold, numb feet at night, but only when she noticed a small wound on her toe that wouldn't heal did she visit a doctor. She was diagnosed with advanced PAD, putting her at risk of amputation if left untreated. In Europe, a study in Germany found that many individuals over 50 suffer from PAD but mistake the symptoms for ordinary aches. In a public health campaign in the UK, the government encouraged people to check their ankle brachial index, ABI, to detect PAD early, reducing hospitalizations and severe complications. What you can do: pay attention if pain occurs repeatedly with movement but disappears with rest. Tempted to try light walking and monitor if symptoms persist or worsen. Friday 3. Speak with a doctor to assess your circulation and overall vascular health. 4. If you have a history of smoking, high blood pressure, or diabetes, monitor for PAD symptoms more closely. Recognizing PAD symptoms early can help prevent serious consequences, improve quality of life, and reduce the risk of dangerous complications. Shomterin. 2. Weak or absent pulses in the legs and feet, a silent red flag. Doctors routinely check for pulses in 3 key locations on the legs: behind the knee, on the top of the foot, and behind the ankle. If these pulses are weak or absent, it could signal a serious issue with blood circulation. Real-life example: the silent danger in the US. A 62-year-old man named Robert noticed that his left foot often felt colder than his right. He dismissed it as poor circulation due to aging. Months later, a minor cut on his toe wouldn't heal, eventually turning into a severe infection. doctors diagnosed him with peripheral artery disease, PAD, a condition where narrowed arteries reduce blood flow to the limbs. Unfortunately, because the issue was caught late, he had to undergo a partial foot amputation. Similarly, in Europe, a 55-year-old woman named Elena experienced unexplained leg pain after short walks. When she visited her doctor, they struggled to find a pulse in her foot. Further testing revealed severe arterial blockages, putting her at risk of critical limb ischemia, a condition that, if untreated, could lead to limb loss. Early intervention with medication and lifestyle changes helped her avoid serious complications. Why? It matters. A weak or missing pulse suggests that arteries are struggling to push blood past a blockage. If left unchecked, it can lead to severe complications such as non-healing wounds, infections, and even gangrene. These conditions are not just a threat to mobility but can become life-threatening if infection spreads. What you can do? Ask for a pulse check. During your next physical exam, request your doctor to check for pulses in your lower limbs to watch for warning signs. If one leg feels colder, looks paler, or changes color compared to the other, don't ignore it. 3. Consider further testing. A Doppler ultrasound or ankle brachial index (ABI) test can assess blood flow and detect early arterial blockages before they become serious. Ignoring these signs could have life-altering consequences. Early detection and proactive care are crucial to maintaining healthy circulation and preventing severe complications. The skin color or temperature changes. Your body's cry for help. Imagine sitting down and suddenly noticing that one of your legs is paler than the other. Or perhaps, when you stand up, your foot turns bluish or purplish. These might seem like minor quirks, but they're actually serious indicators of poor circulation. Blocked arteries mean less oxygen-rich blood reaches your legs, causing them to appear unnaturally pale when elevated. Conversely, when your foot is down, gravity forces blood to pool in the area, creating a blue or purplish tint. For example, in the US, a 58-year-old man noticed his left foot turning pale and cold whenever he sat for long periods. Initially, he dismissed it as a circulation quirk, but it turned out to be peripheral artery disease, PAD, a condition where narrowed arteries reduce blood flow to the limbs. Early detection and treatment saved him from potential complications like tissue damage or amputation. Similarly, in Europe, a woman in her 60s observed that her right leg felt consistently colder than her left, even in warm weather. After consulting a vascular specialist, she was diagnosed with arterial blockage and underwent a minimally invasive procedure to restore blood flow. If one of your legs consistently feels colder than the other, this might also signal a major arterial blockage, preventing warm, oxygenated blood from reaching the tissues. What you can do? Regularly check for color and temperature differences in your legs. If you experience prolonged changes, see a vascular specialist immediately. Avoid prolonged sitting or standing without movement. For instance, take short walks or stretch if you have a desk job or travel frequently. These simple steps can help you catch potential issues early and prevent serious health complications. 4. Slow healing sores or wounds, a dangerous sign. A common misconception is that only diabetics experience slow healing wounds. However, PAD, peripheral artery disease, can also be a major culprit. If you have a small cut, blister, or sore that lingers for weeks without improvement, this could mean your tissues are starved of blood and oxygen, which are crucial for healing. Without proper circulation, even minor wounds can spiral into serious infections or ulcers. 3. For instance, in the US, a 65-year-old man developed a small blister on his foot after hiking. Despite keeping it clean, the blister refused to heal and eventually turned into an ulcer. After visiting a specialist, he was diagnosed with PAD, which had severely restricted blood flow to his foot. So, 3. Early intervention prevented the need for amputation. 4. Similarly, in Germany, a woman in her 70s noticed a small cut on her toe that took months to heal. Fatum 4. She initially attributed it to aging, but her doctor discovered significant arterial blockages. 4. Treatment restored blood flow and prevented further complications. Monitor any wounds on your legs and feet. If they take longer than usual to heal, consult a doctor. 6. Keep your feet moisturized and protected to prevent injuries. For example, wear comfortable, well-fitting shoes and avoid walking barefoot. 7. If you have diabetes, be extra vigilant about foot care. 7. Regularly inspect your feet for cuts, blisters, or sores, and seek medical advice at the first sign of trouble. 8. These steps can help you identify and address circulation issues before they escalate into severe health problems. What you can do: shiny, hairless skin on the legs. A subtle but crucial clue. Have you noticed your leg hair thinning or disappearing altogether? While some hair loss is natural with age, a sudden lack of hair growth in a specific area can indicate poor circulation. Your skin may also appear tight, stretched, or unnaturally shiny due to nutrient deprivation caused by reduced blood flow. Since hair follicles rely on a steady supply of oxygen and nutrients, blocked arteries can cause them to stop functioning properly. For example, in the US, a 55-year-old man observed that the skin on his lower legs had become unusually shiny and smooth, with no hair growth. He initially thought it was a cosmetic issue, but his doctor diagnosed him with PAD, peripheral artery disease. Early treatment helped restore circulation and prevent further complications. In France, a woman in her 60s noticed a bald patch on one of her calves, accompanied by tight, shiny skin. After consulting a vascular specialist, she discovered she had significant arterial blockages. Lifestyle changes and medical intervention improved her condition. What you can do: check for unusual changes in skin texture and hair growth patterns. Talk to your doctor if you notice persistent shininess or bald patches. Improve circulation through lifestyle changes like exercise and a heart-healthy diet. For instance, incorporating foods rich in omega-3 fatty acids such as salmon or walnuts, and engaging in regular physical activity like walking or swimming can make a significant difference. These proactive steps can help you catch circulation issues early and maintain better overall health. Erectile dysfunction, a surprising but telling sign. It might surprise you, but erectile dysfunction, ED, can be one of the earliest signs of blocked arteries, even before you experience leg pain. 1. The same arterial narrowing that affects your legs can also restrict blood flow to the pelvic region, leading to issues with sexual function. Chapter 2. In fact, research suggests that men with PAD, peripheral artery disease, are up to 70% more likely to experience ED. If you're struggling with persistent issues, it could be worth discussing your vascular health with a doctor. 3. For example, in the US, a 50-year-old man sought medical advice for sudden erectile dysfunction. 3. While he initially attributed it to stress, further tests revealed he had significant arterial blockages. 3. Early intervention not only improved his vascular health but also restored his sexual function. 4. Similarly, in the UK, a 45-year-old man experiencing ED was diagnosed with PAD after his doctor linked his symptoms to poor circulation. Factor 4. Lifestyle changes, including quitting smoking and adopting a healthier diet, help improve his condition. If you experience sudden or worsening ED, don't ignore it. Get a vascular checkup. Address risk factors like smoking, high cholesterol and obesity. 6. For instance, quitting smoking, reducing saturated fats in your diet, and maintaining a healthy weight can significantly improve vascular health and reduce the risk of complications. 7. Taking these steps can help you address underlying vascular issues and improve overall well-being. What you can do. 7. Numbness or weakness in the legs. The final warning. If your legs feel weak, tingly, or fall asleep often, this could be a sign of nerve damage due to poor circulation. Over time, insufficient blood flow can lead to muscle wasting, reduced mobility, and increased risk of serious infections. Chapter 2. If left untreated, PAD, peripheral artery disease, related nerve damage can make walking and standing difficult, significantly reducing quality of life. For instance, in the US, a 62-year-old woman began experiencing frequent numbness and weakness in her legs. 3. She initially dismissed it as a sign of aging, but her condition worsened until she struggled to walk. 3. After consulting a specialist, she was diagnosed with advanced PAD and underwent treatment to restore blood flow. 4. In Italy, a 70-year-old man noticed his legs feeling unusually weak and tingly, especially after short walks. 4. His doctor identified severe arterial blockages and recommended a combination of medication and lifestyle changes, including regular exercise, to improve his circulation and mobility. If you experience persistent numbness or weakness, consult a doctor immediately. Engage in physical activity to improve circulation and muscle strength. For example, low-impact exercises like walking, cycling, or swimming can help enhance blood flow and prevent further complications. 7. Taking these steps can help you address circulation issues early and maintain better mobility and quality of life. What you can do. Conclusion: don't ignore the signs. Your health depends on it. Peripheral artery disease isn't just about leg pain. It's a serious, often overlooked condition that can threaten your life. By recognizing the warning signs early, you can take steps to avoid catastrophic outcomes like strokes, heart attacks, or even losing a limb. Your legs are your foundation, carrying you through every step of life. Treat them with care, and they'll support you for years to come. If you or someone you love experiences these symptoms, don't wait. Seek medical help immediately. Your future self will be grateful you did. After all, your health is your greatest wealth. Don't let it slip away.